I'm personally so excited to have the privilege of working on this Healing Communities grant where we can work toward the larger goal of ending preventable overdoses while also meeting people where they are in terms of both location and needs. With Narcan accessible, all overdose deaths are preventable.
Our program works to expand Narcan access in Ulster County. We do that by doing street outreach, doing outreach at local events in the community, trying to connect with people and make sure everybody in Ulster has Narcan, especially in the rural areas. And we also help people get into detox or rehab if they're ready for that. But if not, we have a ton of other harm reduction supplies and services that we're able to help people access. We got our Narcan, our fentanyl test kits, our bleach kits, our fit packs, our condoms, end caps. Great music here at the Woodstock Farmers Market.
As I continue within this field, I'm learning more and more that there are things that can be done. There are interventions out there that can help people. We felt that it was just really important that there be similar means of helping people in the area of overdose. It's really exciting because this fills a critical gap in care and can save lives. Right here in Ulster County,
this gives us an opportunity to really connect with a broader range of folks. At the beginning of the pandemic, it was such a high need. So many people were in their homes, maybe with loved ones who were, in active opioid use. People were scared. They were alone in their homes. They relied on other people for Narcan and things like that in the past. And so we were able to fill that gap and meet that need, which was very exciting because in our minds, it gave people a second chance to really get out there. It brings that aspect of destigmatization, safety, and really dispel some of that hopelessness that I think a lot of those family members feel.
Hi everybody, Phoenix Kawamoto with the Town of New Paltz and coordinator for the New Paltz Opioid Overdose Prevention and Response Team. On behalf of the team, I'd just like to say that we are honored to be part of such a vast network of dedicated professionals, providers, first responders, and community members, all coming together to make a difference in the lives of those who are grappling with the impact of opioid use disorder. Like all of you, we have really been driven by the heartbreak in our communities and really inspired to do everything we possibly can to find the spaces and places where we can find a way to intervene, to discover new strategies and approaches that might help make a difference for those who are suffering. So thank you so much for all that you do, not just in your own communities, but for the generosity of time and resources that you've been sharing with us here in the greater New Paltz area to make a difference in the lives of those we're here to serve. And we are here for you as well. And we will continue to do as much as we can to assist your efforts. We're in this together. And I am extremely thankful to be part of the Healing Communities Grant family. Take good care, everyone.
I think the work that we are doing, it gives the patient the education prior to taking an opiate. It gives them all the alternatives to an opiate, whether it's another specialty or an over-the-counter versus just getting that opiate right as their first option. So educating our community prior is very important to me.
When I think about the programs and what we were able to do, through this grant, I feel really proud, and I feel really humbled to be part of. Somebody is a community, right? I mean, it's not just about me. It's about. I had the idea, but without all the people, it doesn't exist. What makes this place strong and incredible is that it's a community, and when I see that community kind of branch out and reach into other areas and save lives. I'm really moved by that. I'm humbled, and I feel really grateful that I could be a part of that.
Catholic Charities part in this role we call the Caritas bags. Caritas bags are bags that provide basic toiletry items and food items that people can use while they're awaiting treatment services. I'm so happy to be a part of this program, and I couldn't do it without my great team. So I would just like to say thank you to my team and the volunteers who helped prepare the Caritas bags. I'd like to say a thank you to Ulster County Department of Health for thinking of Catholic Charities to be a partner in this initiative.
I'm very excited about our MOUD landing page that we've added to our website. It is another way that we can break down barriers of access to care for Ulster County and get people connected to treatment quickly and efficiently. I'm excited to see where it goes and if we can get more traffic through the landing page, which we can easily track better than we can if someone were to access these services through a different part of our website.
Having a room, having an office, having the space available, that just shows that they are willing to help, willing to step out, willing to just provide opportunity to help them and help them actually get back to that place where they could say, you know, I could wake up today and I could, you know, take that first step. I could wake up today and I could call my mom and say, yes, I'm doing okay today. Don't worry about me. I'm doing okay today. And I think that's the most important thing, is connecting families, connecting the community, connecting each individual that is so important to each one of us. And to just be able to provide that opportunity for them to be able to see how important they are for just that 1 hour that day, I think it means a lot.
Our strategy in partnering with HEAL is to give a safe space for people seeking treatment for substance use disorder by offering use of our equipment either in our office space or in their home. We work with women ages 14 through 48 through all life stages who are high need. And being able to give them access to the technology to complete telehealth visits as well as offer support is a really important part of the solution for us.
I am a person in long-term recovery, and there was a time where I had to navigate the treatment system, and I had to navigate this, you know, the social service system and the human service system. And it really gives me pride and hope that there are people out there who really want to make a difference and make it so much simpler for people who are already struggling. I love working with HEAL because they've done an amazing job at bringing so many organizations from across the county together. And they've brought in a lot of new, innovative ideas. And it's great to have that extra support when we're working with this vulnerable population. And they're there to troubleshoot and help us and, you know, go that extra mile for the population we serve.
We've been involved with the HEAL process and actually with substance abuse issues and particularly opioid issues for a long time. Family takes a position that we have to help people on a one-on-one basis. Every person's situation is different, every person's goals are different. So it's a natural fit for us to respond to the needs of a family of a person that's using substance abuse. It's a natural fit for us to want to help them stay safe and have a shelter overnight and not be in the street.
Childcare, of course, is my passion. I've been with family for over 25 years, always been in with childcare. We get excited, all of our staff, because we want children in a safe, quality place. We want parents to feel comfortable going to work, going to programming, doing anything that they need to do to be successful. And we get excited when we know that they're placed in a quality program and they can succeed.
I think that the HEAL study and the HEAL team has brought together a really wide range of partners that are really needed to solve a problem like this. These partnerships have put together opportunities for some of the individuals in our community that we would have never seen otherwise. It's something that without having such a diverse range of partners, we'd never be able to do it and we wouldn't be as successful.
In our community, we've had a lot of losses due to the opioid epidemic. And so our job is very important to save lives. This whole vision was initiated by Sheriff Figueroa and then also Under Sheriff Benjamin. We also have among our team the Lieutenant Chad Story, who heads the whole Oracle team. We have CO Wilbur Pressman, and we have CO George Hill. We have CO John Gallo, SO Pat Carroll, Detective Mario Tag, and especially we have with us Shekoya Maxwell as well, who's the care coordinator of the whole HRMT team. The job we do is very important to us individually because we believe that we serve an important role. Human lives is very important, and our families, individuals are being affected in our community, especially the young adults. One of the things that drives us is our personal stories and our encounter. A lot of us are in recovery, and a lot of us have gone through adversity that's helped us to be able to help other people as well.
John Bennett, Director of Behavioral Health at Access Supports for Living, has this to say about the new mental health and substance use urgent care they have established at 368 Broadway, Suite 205 in Kingston. We are excited to offer this service to Kingston and Ulster County because people deserve help when they need it. People are invited to walk in when they feel ready to connect and to bring along the support persons in their lives. Getting help right away is key to staying engaged. Why put off until tomorrow if what you know you need is help today?